This webinar is COVID-19 or coronavirus information for people 65 years and older. What is coronavirus? Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as MERS and SARS. Coronavirus disease is a new strain that was discovered in 2019 and has not been previously identified in humans. Coronaviruses are transmitted between animals and people. How does it spread? The virus spreads mainly from person to person through respiratory droplets and coughing and sneezing, and with close contact, 6 feet and under. It also spreads through touching your face after touching infected surfaces, and it can last up to 72 hours on certain types of surfaces. County numbers are still increasing. As of May 22, 2020, there have been 752 cases and 33 deaths from coronavirus. COVID-19 symptoms include fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. Some people are at higher risk of getting very sick from this illness. This includes people 65 years old and older, people who have serious chronic medical conditions like heart disease, diabetes, or lung disease, and people who have compromised immune systems. California is currently sheltering in place until further guidance is issued. Cancel any non-essential outings, travel, appointments, etc. Reschedule routine medical and dental care if possible, and consider phone appointments or in-home care. If you have an emergency, call 911. But you can continue outdoor activities such as walks, runs, and yard work as your health allows, but practice social distancing. Social distancing means maintaining a distance of at least 6 feet between yourself and others. You should avoid handshaking, hugging, or other intimate types of greeting. People, especially those at higher risk, should avoid all social gatherings of any size at this time. Stay in touch with others through technology. Use your phone, email, or other online tools like Skype and Facebook, and consider ordering online for things that you need. Ask for help from friends, family, neighbors, etc. to do essential grocery shopping or pick up medications, or from friends, family, neighbors, community health workers, etc. if you become sick. Identify friends, family, neighbors, and other networks who can provide you with care if your caregiver gets sick or adjust their scheduled services. Those who come to your home to provide support should have no fever, cough, or other respiratory symptoms. Have supplies in your home. Contact healthcare providers to ask about obtaining extra necessary medications for people in your household to have on hand, and you need to stay home for a prolonged period of time. If you cannot get extra medications, consider using mail order. Be sure you have over-the-counter medicines and medical supplies such as tissues to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. Have enough household items and groceries on hand for everyone in the home so that you will be prepared to stay at home for a period of time. Remember to ask for help. Plan for those in your home that are at higher risk. Know what medications your loved one is taking and see if you can help them have extra on hand. Monitor food and other medical supplies, including oxygen, incontinence, dialysis, and wound care supplies. Create a backup plan. Stock up on non-perishable food to have on hand in your home to minimize trips to stores. If you care for a loved one living in a care facility, monitor the situation, ask about the health of other residents frequently, and know the protocol if there is an outbreak. Prevention. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Currently, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These coverings can slow the spread of the virus. They help people who may have the virus and don't know it from transmitting it to others. Surgical masks and N95 respirators are not recommended. These are critical supplies that must be continued to be reserved for healthcare workers and other medical first responders. If you choose to make and wear a face covering, remember that they should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to shape. Clean and disinfect frequently touched surfaces daily, including tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them using detergent or soap and water prior to disinfection. At this time, there is no evidence that pets can spread COVID-19 to humans, and there is no reason to take measures against companion animals that may compromise their welfare. CDC recommendations include: do not let pets interact with people or other animals outside the household. Keep cats indoors when possible to prevent them from interacting with other animals or people. Walk dogs on a leash, maintaining at least 6 feet from other people and animals. Avoid dog parks or public places where a large number of people and dogs gather. And wash your hands before and after touching or feeding animals. Create a household plan. Talk with the people who need to be included in your plan. Meet with household members and talk with the other relatives and friends to discuss what to do and what the needs of each person will be. Create an emergency contact list. Ensure your household has a current list of emergency contacts for family, friends, neighbors, carpool drivers, healthcare providers, teachers, employers, the local public health department, and other community resources. Know your community. Get to know your neighbors. Talk with them about emergency planning. If your neighborhood has a website or social media page, consider joining it to maintain access to neighbors, information, and resources. Identify aid organizations in your community. Create a list of local organizations that you and your household can contact in the event that you need access to information, healthcare services, support, and resources. Consider including organizations that provide mental health or counseling services, food, and other supplies. Reduce the spread. If you or someone in your home gets sick, stay home except to get medical care. People who are mildly ill with COVID-19 are able to recover at home. Do not leave except to get medical care, and do not visit public areas. Stay in touch with your doctor. Call before getting medical care. Be sure to get care if you feel worse or you think it is an emergency. Avoid using public transportation, ride sharing, or taxis. Separate the sick and healthy in your home. As much as possible, people who are ill should stay in a specific sick room and away from other people in your home. Use a separate bathroom if available. You should restrict contact with pets and other animals when you are sick. When possible, have another member of your household care for your animals while you are sick with COVID-19. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with them. If you are sick, you should wear a face mask when you are around other people, even family members, and before you enter a healthcare provider's office. If you are caring for others and the person who is sick is not able to wear a face mask, for example, because it causes trouble breathing, people who live in the home should stay in a different room. When a caregiver enters the room of the sick person, they should wear a face mask. Visitors other than the caregiver are not recommended. Call ahead before visiting your doctor. If you or a family member has a medical appointment, call the doctor's office or emergency department and tell them you or a family member may have COVID-19. This will help the office protect themselves and other patients. Avoid sharing personal household items, including dishes, drinking glasses, cups, eating utensils, towels, or bedding. Wash all items after use with soap and water, or put them in the dishwasher or laundry. Monitor your symptoms by seeking medical care right away if your illness is worsening. For example, if you have difficulty breathing. Call your doctor before going in. Tell them your symptoms and they will tell you what to do. If possible, put on a face mask before you enter a building. If you can't put on a face mask, try to keep a safe distance from other people of at least 6 feet. This will help protect the people in the office or waiting room. Follow care instructions from your healthcare provider. Your provider will give instructions on checking your symptoms. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a face mask before medical help arrives. Here are some things you can do to support yourself. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body by taking deep breaths, stretching, or meditating. Try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Make time to unwind by trying to do some other activities you enjoy. Talk with people you trust about your concerns and how you are feeling by phone or video chat. If stress gets in the way of your daily activities for several days in a row, call your healthcare provider. If you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel like you want to harm yourselves or others, call 911 or the Substance Abuse and Mental Health Services Administration's Disaster Distress Helpline. How to discontinue home isolation. If you will not have a test to determine if you are still contagious, you can leave home after these 3 things have happened. 1. You have had no fever for at least 72 hours, that is 3 full days of no fever without the use of medicine that reduces fevers. 2. Other symptoms have improved, for example, when your cough or shortness of breath have improved. And 3. At least 10 days have passed since your symptoms first appeared. If you will be tested to determine if you are still contagious, you can leave home after these 3 things have happened. 1. You no longer have a fever without the use of medicine that reduces fevers. 2. Other symptoms have improved, for example, when your cough or shortness of breath have improved. And 3. You received 2 negative tests in a row, 24 hours apart. Your doctor will follow CDC guidelines. Here is a list of COVID testing sites in San Joaquin County. Contact these healthcare providers by phone or online for assessment and referral. This list can also be found on the San Joaquin County Public Health Services website. Continue to stay well informed by visiting the following sites for updated COVID-19 information: the San Joaquin County Public Health Services website, the Centers for Disease Control and Prevention website, and the California Department of Public Health website. For San Joaquin County resources and help, call San Joaquin 211 for community resources or the San Joaquin County Aging and Community Services Hotline. Thank you very much.